Have you ever noticed a strange or persistent body odor that just doesn't seem right? Maybe it's a sour smell from the skin, a strange fruity breath, or even an odd scent from the ears. Most of us chalk it up to age, diet, or poor hygiene. But what if I told you these smells could be your body's way of waving a red flag? Hi there, thank you and welcome back to the channel where we talk about natural health, graceful aging, and how to live your best life after 50. Today, we're diving into something a little unusual, but incredibly important. 8 hidden body smells that could signal deeper health problems, especially for seniors. Stick around because smell number 4 is surprisingly common, but often ignored, and it could save someone's life. Learn the language of the body and why smell matters. Here's the thing. Your body is constantly sending you signals. It tells you when you're tired, when you're hungry, or when you're in pain, but sometimes it speaks in whispers, like a faint change in scent. And while it might seem odd, these body smells can offer early clues into what's going on beneath the surface. Body odor is not just a hygiene issue. It can be an external marker of internal health. So today, we're decoding 8 of these often overlooked smells, what they mean, why they happen, and what you can do naturally to manage or even reverse the underlying causes. Let's jump in. Smell number 1. Fruity breath could signal diabetes. Let's start with a sweet one, literally. If you notice fruity or sweet-smelling breath, especially in a senior who hasn't had anything sugary recently, it could be a warning sign of diabetic ketoacidosis, a serious complication of diabetes. This happens when the body can't use sugar properly and starts breaking down fat for fuel, releasing ketones that smell like fruit or even nail polish remover. This is more common in older adults whose blood sugar levels aren't well controlled. Here's a natural tip you can try. If you notice this smell, check blood sugar levels immediately. Managing blood sugar through a low-glycemic, fiber-rich diet, like leafy greens, berries, and legumes, can help. Add in herbs like fenugreek or cinnamon, which have been shown in studies from the National Center for Complementary and Integrative Health to support healthy glucose levels. And of course, if that smell persists, seek medical advice right away. Smell number 2. Ammonia-like sweat may signal kidney issues. Next up, have you ever noticed sweat that smells like ammonia or even urine? This odor can happen when the kidneys aren't filtering waste properly and excess urea builds up in the body. When it's excreted through sweat, it can have that sharp, pungent smell. This could be an early sign of chronic kidney disease, especially common in older adults and those with high blood pressure or diabetes. Here's what you can do. Stay hydrated. Proper water intake helps flush toxins and supports kidney function. Also consider kidney-friendly herbs like nettle leaf or dandelion tea, which have been traditionally used to support urinary health. And reduce salt and processed foods. Your kidneys will thank you. Smell number 3. Fishy body odor could signal metabolic disorder. This one's rare but important. A strong, fishy odor coming from the body could be a sign of a condition called trimethylaminuria, also known as fish odor syndrome. It's a metabolic disorder where the body can't break down trimethylamine, a compound found in certain foods like eggs, fish, and legumes. While more common in younger individuals, some cases appear or worsen with liver dysfunction or hormonal changes in seniors, according to research from the National Institutes of Health. Help your body by avoiding foods high in choline and trimethylamine, like eggs, liver, and some seafood. Probiotics may help rebalance gut flora and reduce this odor, and activated charcoal under a doctor's guidance can sometimes be beneficial. Smell number 4. Musty or moldy smell could point to liver problems. Here's the one you can't ignore. A musty or moldy odor, especially from the breath or skin, can indicate liver issues. This smell, sometimes described as slightly sweet or stale, is associated with a condition called fetor hepaticus, and it often points to liver dysfunction or failure. This smell results from sulfur-containing compounds that build up when the liver can't filter them out. Start consuming these foods. If liver health is a concern, adopt a liver-friendly diet. Cruciferous vegetables like broccoli and cauliflower, turmeric for inflammation, and dandelion root tea. Studies from the University of Maryland Medical Center also suggest milk thistle as a powerful liver-supporting herb. And if this smell is persistent, please see a doctor. Liver issues can escalate quickly. Smell number 5, sour body odor, could signal hormonal imbalance. A sharp, sour body odor, especially around the armpits or groin, might not just be due to sweat. In many seniors, especially women in postmenopause, shifts in hormone levels, particularly estrogen, can affect how sweat interacts with skin bacteria, producing stronger or unfamiliar scents. According to the North American Menopause Society, estrogen affects skin pH and oil production, which can change how you smell. If you are experiencing this body odor, here's what you can do. Eating hormone-balancing foods like flax seeds, pumpkin seeds, and cruciferous veggies can help. Herbal allies like black cohosh or chasteberry may also offer support, but consult your healthcare provider first. And don't underestimate the power of regular movement. It helps rebalance hormones naturally. Smell number 6, bad breath. Despite brushing, could signal digestive or lung problems. If you've ever met someone whose breath smells bad even after brushing and mouthwash, this could be more than a dental issue. Persistent bad breath or halitosis may point to acid reflux, H. pylori infection, or even early signs of lung infection or disease, particularly in older adults. Chronic halitosis should never be ignored, especially if it's paired with a cough, digestive discomfort, or changes in appetite. Include these foods in your diet to stop bad breath. Support digestion with fermented foods like sauerkraut or kefir, and drink ginger or fennel tea after meals. For the lungs, consider mullein tea, which is known for its lung-soothing properties. And of course, don't skip regular dental visits. Oral health is deeply tied to systemic health, especially in older age. Smell number 7, smelly feet, could signal fungal infection or diabetes. We've all dealt with foot odor, but if it becomes persistent or worse with age, it could be more than just a hygiene issue. Fungal infections, like athlete's foot, thrive in moist, warm environments and can smell particularly strong. Seniors with diabetes are especially vulnerable due to impaired circulation and immune response. Foot odor in seniors can also indicate diabetic neuropathy, where nerve damage impairs skin integrity and infection detection. Here's a quick tip for smelly feet. Try soaking feet in apple cider vinegar and warm water, or a few drops of tea tree oil, known for its antifungal properties. Keep feet dry and wear breathable socks made of natural fibers like cotton or bamboo. If sores or numbness accompany the smell, see a podiatrist immediately. Smell number 8, earwax that smells, could signal ear infection or impaction. Here's one people rarely think about: smelly earwax. While earwax normally doesn't have much of a scent, a strong, foul odor could point to an ear infection, yeast overgrowth, or wax impaction, especially in older adults with hearing aids or reduced ear self-cleaning. This is more common in seniors due to changes in ear canal shape, reduced cerumen production, and increased use of devices like earbuds or hearing aids. You can try this. Keep ears clean, but don't over-clean. Too much scrubbing can worsen problems. A few drops of warm olive oil or hydrogen peroxide, diluted, can gently soften and remove wax. Avoid inserting cotton swabs deep into the ear canal. If hearing loss, discharge, or pain is present, consult an ENT. So there you have it, 8 unexpected body odors that could be sending powerful messages about your health. As we age, it's more important than ever to tune into these subtle signs. Our bodies are constantly trying to protect and heal us, but we have to listen. From fruity breath that could signal diabetes, to musty smells that whisper of liver trouble, to foot odor hinting at something deeper, these aren't just nuisances, they're messages. The good news? Many of these signs are manageable or even reversible, especially when caught early and treated naturally. And remember, this isn't about fear, it's about awareness. Empowering yourself or a loved one with knowledge is one of the kindest, most powerful things you can do. Which of these smells surprised you the most? Let me know in the comments, and if you found this video helpful, drop a number 4 to let us know you're still here and paying attention. Don't forget to like, subscribe, and turn on notifications so you don't miss our next video on living longer, feeling better, and aging naturally with grace. Thanks for watching, and remember, your body is wise. All we have to do is listen. See you in the next one.